Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. The Lancet study finds particulate matter air pollution to be at par with smoking in contributing to subarachanoid hemorrhage. Although stroke is highly preventable and treatable, there has been a rapid rise in the global stroke burden between 1990 and 2021 due to both population growth and the rise of aging populations worldwide, as well as a substantial increase in people's exposure to environmental and behavioral risk factors. The findings of this major new analysis from the Global Burden of Diseases, Injuries and Risk Factors study were published in the Lancet Neurology journal and were presented at the World Stroke Congress in Abu Dhabi. The current study builds on the previous Global Burden of Diseases analysis to provide the most up-to-date and comprehensive analysis of stroke burden and risk factor estimates in countries on a global scale between 1990 and 2021 to help guide health planning, prevention and resource allocation. Lead author Professor Valerie L. Fegan from Auckland University of Technology, New Zealand, and affiliate professor at the Institute for the Health Metrics and Evaluation at the University of Washington, USA, said the global growth of the number of people who developed stroke and died from or remain disabled by stroke is growing fast, strongly suggesting that currently used stroke prevention strategies are not sufficiently effective. New proven effective population-wide and motivational individual prevention strategies that could be applied to all people at risk of having a stroke, regardless of the level of risk, as recommended in the recent Lancet Neurology Commission on Stroke, should be implemented across the globe urgently. The study reveals striking differences in the overall stroke burden between world regions and national income levels in 2021. In high-income North America and Australasia and middle-income Latin America regions with the lowest stroke burden, the age-standardized rates of incidence and prevalence were lowest in New Zealand, death rates lowest in Canada, and disability-adjusted life years rates lowest in Australia in 2021. In contrast, in the regions of low and middle income East and Central Asia and Sub-Saharan Africa, the rates of incidence, prevalence, death and disability-adjusted life years were up to 2 to 10 times higher in 2021. Strikingly, half of all the disability and the lives lost to stroke globally in 2021 were the result of hemorrhagic strokes, the deadliest form, mainly due to the high blood pressure, despite being around half as common as ischemic strokes. Most affected were people aged 70 and younger and those living in low-income countries where the proportion of strokes that are intercerebral hemorrhage is double that of high-income countries. Stroke-related health loss disproportionately impacts many of the most disadvantaged countries in Asia and Sub-Saharan Africa due to the growing burden of uncontrolled risk factors, especially poorly controlled high blood pressure and rising levels of obesity and type 2 diabetes in young adults, as well as the lack of stroke prevention and care services in these regions, explained co-author Dr. Catherine O. Johnson, lead research scientist at IHME. The shift in stroke burden towards younger populations is likely to continue unless effective preventive strategies are implemented urgently. The study estimates that the total number of stroke-related disability-adjusted life years attributable to 23 risk factors globally has risen from 100 million years of healthy life lost in 1990 to 135 million in 2021, presenting a public health challenge and an opportunity for action. The largest proportion of these risk factors are found in Eastern Europe, Asia and Sub-Saharan Africa. Metabolic risk factors, especially high BMI, high systolic blood pressure, high LDL, cholesterol contributed to the most stroke burden across all country income levels in 2021, followed by environmental risk factors collectively, that is air pollution, lower high ambient temperature, lead exposure. In low middle income countries, in 2021, the 5 leading global risk factors for stroke were high systolic blood pressure, particulate matter air pollution, smoking, high LDL cholesterol and household air pollution with considerable variation by age, sex and location. For the first time, the study suggests that ambient particulate matter air pollution is a top risk factor for subarachnoid hemorrhage, contributing to 14% of the death and disability caused by this serious stroke subtype, on par with smoking. In contrast, substantial progress has been made in reducing the global stroke burden from risk factors linked to poor diet, air pollution and smoking, with health loss due to diets high in processed meat and low in vegetables declining by 40% and 30% respectively. Particulate matter air pollution by 20% and smoking by 13%. This suggests that strategies to reduce exposure to these risk factors over the past 3 decades, such as clean air zones and public smoking bans, have been successful. With 84% of the stroke burden linked to 23 modifiable risk factors, there are tremendous opportunities to alter the trajectory of stroke risk for the next generation, said Dr. Johnson. Given that ambient air pollution is reciprocally linked with ambient temperature and climate change, the importance of urgent climate actions and measures to reduce air pollution cannot be overestimated. And with increasing exposure to risk factors such as high blood sugar and diet high in sugar-sweetened drinks, there is a critical need for interventions focused on obesity and metabolic syndromes. Identifying sustainable ways to work with communities to take action to prevent and control modifiable risk factors for stroke is essential to address this growing crisis. As Professor Fejan explained, additional and more effective stroke prevention strategies with an emphasis on population-wide measures such as task shifting from doctors to nurses and health volunteers, and the wider use of evidence-based mobile and telehealth platforms, along with pragmatic solutions to address the critical gaps in stroke service delivery, workforce capacity building, and epidemiology surveillance systems must be urgently implemented across all countries. That's all for today. Thank you for watching Medical Dialogues. Stay tuned for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.